Hello and welcome to Headline News in Lung Cancer from the recently concluded ASCO 2012 meeting in Chicago, Illinois. I'm Steve Highsmith. We have selected various research findings presented at ASCO this year, and we will review highlighted information from those selected abstracts. For a more detailed review of each of the abstracts, we encourage you to please click on the links below this video. Our first story is about the investigational anaplastic lymphoma kinase, or ALK inhibitor. LDK-378 showed substantial clinical activity in patients with ALK-positive non-small cell lung cancer, with an overall response rate of 81% in patients previously treated with the FDA-approved ALK inhibitor crizotinib. Results of this dose escalation phase 1 study were presented by Dr. Armera of Fox Chase Cancer Center. LDK-378 showed substantial activity in patients with ALK-positive non-small cell lung cancer. The overall response rate was 81% among the 26 patients previously treated with crizotinib, who then received LDK-378 at doses of 400 milligrams per day or greater. The objective response rate among all 33 patients with non-small cell lung cancer receiving at least 400 milligrams per day was 67%. Anti-tumor activity was also observed in brain metastases at the maximum tolerated dose of 750 milligrams. No responses were observed in other tumor types, including in ALK-amplified breast cancer. In her discussion of the results, Dr. Eunice Kwok of the Massachusetts General Hospital Cancer Center noted that these findings raise an array of new questions regarding the use of ALK inhibitors. Important topics for additional research include the identification of resistance mutations or mechanisms in which LDK-378 is effective, the optimal sequencing of ALK-targeted therapies, mechanisms of primary resistance, activity in brain metastases, and the role of combination therapy with multiple targeted agents. There were two abstracts presented on the topic of new molecular targets to find treatment in non-small cell lung cancer. In the first abstract, Dr. Alice Sang Shaw of Massachusetts General Hospital Cancer Center presented updated results of the first clinical validation of ROS1 as a therapeutic target in cancer on behalf of her colleagues. The investigators examined the efficacy and safety of standard oral crizotinib, 250 milligrams twice daily, in advanced non-small cell lung cancers harboring ROS1 gene rearrangements as determined by a break-apart fluorescence in situ hybridization assay. 15 patients were enrolled and 14 were evaluable for response. The median age of these patients was 54, and all but one of the patients were non-smokers. 80% had received one or more prior therapies, all had adenocarcinomas, and none had ALK rearrangements. The pharmacokinetic profile of crizotinib in this group of patients was similar to that observed in patients with ALK-positive non-small cell lung cancer. To date, the overall response rate is 57.1%, or 8 of 14 patients, with 7 partial responses and 1 complete response. 4 patients have stable disease. Median duration of treatment is underestimated at 26 weeks, as the treatment of 12 patients is still ongoing. The disease control rate, complete or partial response plus stable disease, at 8 weeks was 79%. Dr. Shaw concluded that chromosomal rearrangements of the ROS1 receptor tyrosine kinase gene define a new molecular subset of patients with non-small cell lung cancer for whom crizotinib therapy may be highly effective. This phase 1 dose expansion study is continuing enrollment, and the use of crizotinib will be evaluated in other cancers with ROS1 gene rearrangements. In the second abstract, Dr. Julie Brommer of the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins presented updated results for a novel agent, BMS 936558, which is a fully human monoclonal antibody that functions as a checkpoint inhibitor. In a phase 1 study, BMS 936558 was administered intravenously every 2 weeks to patients with various solid tumors, including non-small cell lung cancer, at doses of 0.1 to 10 milligrams per kilogram during dose escalation and/or cohort expansion. Of the 296 patients treated through February 2012, 122 patients with non-small cell lung cancer were evaluable for safety, and 76 patients with non-small cell cancer were evaluable for clinical activity. Clinical activity was observed at all dose levels. The overall response rate for patients with non-small cell cancer was 18%. Progression-free survival at 24 weeks was 26%. Dr. Brommer concluded that BMS 936558 can be administered safely in an outpatient setting to heavily pretreated patients with advanced non-small cell lung cancer, and that durable clinical benefit was observed regardless of tumor histology. In the discussion section of the presentation, Dr. Giuseppe Giaccone of the National Cancer Institute noted that BMS 936588 appears to be better tolerated than ipilimumab, although severe pneumonitis is of concern. Afatinib is a selective, orally bioavailable, irreversible ERB family blocker of EGFR and HER2. This global study investigated the efficacy and safety of Afatinib compared with pemetrexed cisplatin in patients with EGFR mutation-positive advanced lung adenocarcinoma. Following central testing for EGFR mutations, 345 patients, stage 3B, 4, PS 0 or 1, chemo-naive, were randomized 2-to-1 to daily Afatinib 40 milligrams or IV pemetrexed cisplatin. The primary endpoint was progression-free survival by central independent review. Treatment with Afatinib led to a significantly prolonged PFS versus pemetrexed cisplatin, median PFS of 11.1 versus 6.9 months. Objective response rate was significantly higher with Afatinib, 56% versus 23%. The most common drug-related adverse events were diarrhea, rash, and paronychia with Afatinib, and nausea, decreased appetite, and vomiting with pemetrexed cisplatin. LUX-Lung-3 is the largest prospective trial in EGFR mutation-positive lung cancer and the first study using pemetrexed cisplatin as a comparator. Treatment with Afatinib significantly prolonged PFS compared to PC, with significant improvements in secondary endpoints. AEs with Afatinib were manageable with a low discontinuation rate, with 4.2 months PFS improvement in the overall population and 6.7 months in patients with common mutations. Afatinib is a clinically relevant first-line treatment option. That's going to wrap things up on this edition of Oncology.TV Headline News in Lung Cancer at the ASCO 2012 meeting. Remember, if it's happening in oncology, it's happening on Oncology.TV.